So, I just made a video about like a nursing shortage, and this actually triggered another story that I wanted to tell you. This is a personal story, so this is kind of a story time. And I've been wanting to tell this story for a while because I want this to be used as like encouragement or inspiration to just like keep going when you're a new nurse, okay? You're gonna make a lot of mistakes, and that's okay. But I think in order for one to thrive as a new nurse, I think you have to be in the right environment. So let me just start this story off, okay? So this was almost, maybe it was even a decade ago. I got my first nursing job. Okay, I took my boards, passed, and I did great. And the last year in nursing school, I actually was on a cardiac step down unit. And I'm not going to tell you hospitals or anything like that, just because I'm trying to, I don't know, not put them fully on blast, but just give you enough information. Anyways, so I was a nursing student, and in my last semester, I was in a cardiac step down unit, and I really liked the floor. I really liked the nurses there. They were all really helpful, and I just really liked that it was more of a higher acuity, and I think it like really helped me to like put the pieces together. I really do like cardiac nursing is probably my favorite. It's still my favorite if I would go back. Anyways, and so while I was there, my preceptor for those of you who don't know, like it's kind of like it's a more seasoned nurse, but they act as a mentor and they kind of teach you, and they're supposed to help you and just get you kind of settled in the floor. But so my preceptor, like we had a really great relationship. Like I really liked her, she liked me. Like she knew that I was really like any situation that I've never seen before. She was like, do you want to see it? And I was like, yes, absolutely. And so she was really impressed with like my knowledge, so much so that she recommended that I do apply for this critical care internship. And I was like, okay. So I did. I interviewed, I got right in, and I was so excited about it. And I was like, this is one of the best hospitals to learn about cardiac stuff. And I was so excited. Okay. So the program I think started like late fall, and the way that it worked was you had class time, then you would have like floor time. So you would learn about all kinds of procedures and illnesses, and then you spend time on whichever floor that you're going to work on, and you get used to it, you get to know the staff. So I should have known that like immediately my stomach kind of started to churn when I went to the floor one day, and I was asking about all these nurses that I worked with. It was summertime, so I wasn't there and doing other stuff. So I came back, and I was like so excited. I was asking about all these nurses who had been there, and like two of like my favorite nurses had already left, and I was like, oh, shit. They could have been a good support system, but two of them had already left, and I had found out that I was going to be working nights because I guess traditionally, and I don't even know if I buy traditionally, but you like traditionally like nights is supposed to be quieter. You get to like learn. I mean, you learn at I guess a less. I want to say because nights is really busy. Let me just be clear. Nights can be very busy, so I think that's kind of like a nursing myth. But anyways, they say that it's quieter on nights, so it gives you more time to learn. Blah blah blah. So I was gonna be starting on nights anyways, and all these people were day shift and they were gone. So I was like, great. Anyways, okay, so I had my so she was like a professor, and how do I say this nicely? She just seemed like the type of person where like if you weren't laughing at all of her jokes, or you weren't like you just weren't like always in her face trying to like I don't know, make her feel important. She just maybe didn't necessarily like care about you. I don't say that. I don't know how to explain it, but that's the vibe she gave me. Like I was like, just because I was just there to like kind of, I was quiet and I just wanted to be like as the best student I could, and I don't know. I've worked with a lot of people like that where like they're kind of like nice. They're nice nasty. That's what it is. She's nice nasty. Okay. Um and so I was really happy about this. Like I was like, okay, yeah, I'm here to learn. Everyone else is here to do the same, blah blah blah. And then like slowly things started to like fall apart. And one of the things that started, so I'll give you an instance. One day I was just like having bathroom problems. Okay. I don't know if that's too much information, but that's what was happening. And I had to leave the classroom to go take care of business. So I left. And she, after class, actually, she didn't even tell me, which I hate when people don't address issues right then and there. She sends me an email, and then she sends an email to the lady who would be my new boss. She sends an email saying, you leaving, getting up in the classroom to go to the bathroom was disruptive. And I was just like, I just thought that was such a aggressive word to use, like disruptive, because like I'm going to the bathroom and I'm an adult. Am I supposed to ask for permission to go to the bathroom? So there's that. Okay. So I was just like, I mean, if it was a problem, like just like let me know. But I've always, those are one of those interactions where I've ruminated about that for years, and I was like, I just don't understand. Like I would get up quietly. I mean, I did get up a lot that day, but I was like, I had troubles. But she just wrote, I don't know, like I feel like I wouldn't necessarily CC something to a boss right away. If I don't know. It was really weird. So anyways, there was that. And then there was this one time, maybe like the next week, where we had a presentation. So we was in this auditorium and I was at the presentation, but again, I had to go to the bathroom. So I went to the bathroom, I left. But whilst I was going to the bathroom, I happened to pass my professor's office, and I needed to turn something in to her, like an assignment or something. So I did that. And then she comes out and she's like, what are you doing here? And I was like, oh, I just kind of like went to the bathroom. But I was here, like, I just thought I just dropped this off real quick and I'm heading back. And she was like, you're supposed to, like, this is not where you're supposed to be. And I was just like, I was just dropping this off. I don't know, like, I just didn't know what to say, because I just thought, again, I just was like, what is the big deal? But I don't like saying that to people because I don't want them to seem dismissive. So then after that, she followed up again with another email to my future boss explaining like, oh, well, she left a presentation to go drop something off. And that wasn't the case. I just went to the bathroom and I happened to be in that area. So that was, so these little things are starting to like make me feel uncomfortable, because I just didn't feel like we were starting out on a good foot. And I'm not even on the floor yet. This is just kind of like orientation. And I knew that this lady had a lot of influence. And I think and to be perfectly honest, I didn't realize that because I was so well liked, there was a part of the interview process that I had actually bypassed. I didn't know this, but basically, because the other preceptor that I had mentioned earlier, who I got along with, she had put in a good word with the boss already. It was already a done deal because the other lady had just as much sway. So I think a part of her was miffed that I didn't come through her process as well. I forgot to add that in there as well. So again, I'm feeling uneasy because I just feel like we're not off to a good start. I'm not even at the crazy part of the story yet, okay? I'm trying to give you like what I think nurses do sometimes to other nurses. So then there was that. So then finally, I don't know, there was something, so there was like a third interaction where I actually had to talk to this preceptor. I had to come to her about something. I don't know if I had like failed an exam or failed something. And I was like, let me go to her and ask her, to explain this. So we're sitting there And she just like was kind of like, I can tell you're smart. And I don't know why that rubbed me the wrong way, but it did. And I think it's because, well, yeah, I'm smart. Everybody here is smart, but why are you saying this comment to me specifically and out of nowhere? I should also mention I was the only black person in this class. Let me just throw that out there, okay? She was like, yeah, I can tell you're smart. And I didn't know what to say. That, yeah, I'm smart, like everyone here is smart, but yes, I'm smart. Like, so the conversation was just really weird. Like, we started talking about whatever I came in there for, but I just thought it was kind of just a really odd thing to say. All right, so finally I get through the orientation. Now I'm on the floor, okay? And I had to orient uh on days first, and then my final destination, which would be nights. And actually, I like the people on days as well. And a part of me, I was like, oh, this is, I did well on days, because I think I had the right people who either would help me along. If I was struggling, we would talk about it, and we would move forward from there. And then once I got on nights, all the shit fell apart. And so I had a preceptor who I would say is a good nurse, but in my opinion, we weren't a good fit, because she was one of those super anal nurses, and that's how I mean, like, she's anal, and she's a good nurse, but she was just one of those, if it's not done my way, then it's either I'm gonna dismiss you and not help you. Okay, let me back up. So, all right, so first couple of nights, it was fine. But I was really struggling because on night shift, first of all, this particular unit is ginormous. Okay, it's so huge, and sometimes they put patients at the end of the opposite end of the hallway, and it's just really hard to like cluster care when your patients are all over the place in this ginormous floor. So I was really kind of struggling with, you know, my organization because I was new. And I remember one night she said to me, oh God, what exactly, how did she say it? She was like, you're really struggling. But it wasn't in an empathic way, or like something where I felt like she was a compassionate way. She just was like, you're really struggling. And initially my response was, I kind of chuckled, but once I saw that she wasn't like chuckling back, that's when I knew, like, oh shit, I don't think this is going to go well. And so there are other stories, like, and I'm trying not to make this video super long, but like one of the things that I thought was, so she was telling me, so like one night we're discussing all of our patients, and she was like, you're having this patient come in from the cath lab, but there's your other patients like actively vomiting. So I was like, okay, again, I'm a new nurse, so I'm kind of flustered. So I was like, okay, let me go take care of this vomity person. And I was pushing like Finnegan, and then she kind of like comes in and not stomps her foot, but she's just like, I'm going to go in the room with your admit. And I was like, oh, okay. And I was in the assumption that she was maybe going to do, like, there's a list of things when someone gets admitted. One of them is you have to fill out all this admission work, and then you have to take their vitals, you have to get them settled, you have to start what if they need like IV lines, do all that. So I was like, okay, maybe that will buy me a little bit of time, because maybe she will do that, some of that. Do you know, once I was done, and I forgot what I got a little tied up in that room, but do you know that when I went down to finally to the submission, she literally was standing on a wall. She was literally just posted up like this, watching this patient. Like, she did nothing. So I walked in the room and I was like, so what do I need to do? And she was like, everything. And I was like, admission? She's like, yeah. Like, I forgot, there was like another, I think maybe the doctor or somebody was in there talking, but she just like, and like, she just did nothing. And I was just like, oh my God. So, and a lot of these procedures, like, because I'm new, like, it's not that the procedures I'm feeling with, but the protocols. Let me explain that, because each floor has their own protocols depending on whatever the procedure is. And so she, like, I had to ask her a million questions, and it was like pulling teeth to get information. Like, she just would not, the answer was very like concrete. And then it was like, and then if there's another part of the question that, or if there was something else, she would add it on, but I just didn't understand, like, why didn't you tell me all this up front? And I became very frustrated because I was like, I don't know what is, like, why are you not communicating to me about these protocols? Like, one night I had a guy who I thought was throwing a clot. So we called the doctor in the middle of the night, and this is a doctor I was not familiar with. I think he was like a vascular guy, and it was something about a heparin drip. But the heparin drips I'm familiar with, but this heparin drip was different. So like when I was like putting in the protocol, she was like, "That's the wrong protocol," and I was like, "But it's a heparin protocol." And she was like, "Well, for him, it's this." And I was like, "So you sat in the room the entire time, and you said nothing? Like you didn't?" I was like, "I don't understand what's happening here," and I became very frustrated and annoyed with her. Because she was sitting there watching me put in the wrong protocol. And I mean, that's low-key dangerous. Like, but it wasn't until I asked, it wasn't until I asked a question, thank God. And then she was like, "Oh, it's not that protocol, it's this protocol." So there were many instances like this. This one time, like there's a CHF patient who he had a softer blood pressure, but he still had a very big dose of PO, was it labetalol, I think. It was like, I don't know, it was like 100 million. It was, I can't remember. It was a very large dose of PO, was it labetalol or metoprolol? I cannot remember. One of the two. Anyways, I gave it to him because I remember learning in school that like when you're talking about CHF and a person has like an EF, ejection fraction of like 15% or something, like they still need their hearts to be working. Like you're not necessarily treating the blood pressure, you're treating like how effective the heart's pumping. So even with my very new knowledge, I still applied that. And then she was like, "Oh, you shouldn't have given that. I would have held it, blah blah blah." I think his blood pressure was like 95/60 or something. And it was like, I don't remember the dose because this was almost a decade ago, but I do remember the blood pressure was soft and the dose was high. So now she had me feeling all like insecure. And so she's like, "I'm going to check it after like 30 minutes. So, all right, we're sitting there. And after 30 minutes, we go back, and the guy's blood pressure was even higher. It was like 120/80. And so she was like, "Oh." And then she just kind of like looked down and didn't like, just like ignored what just happened. "No, good job, Cassie. No, like that's great using your critical thinking skills." Nothing. Like she could not bring herself to say like, "You did a good job." Okay. So, because she was expecting his blood pressure to tank, and it did not. So there was many stories like that. Like I was giving, and as the time progressed, she was wearing me down. There was another situation where like there was this very toxic nurse, and everybody knew she was toxic, but apparently she was good at her job. And then like I had an interaction. I had to give her report, and she like eviscerated me in front of everybody. And I was so upset. I started like, I tried to hold it together. I started crying, and the other preceptor, not this one I'm talking about, she was a day shift preceptor, she was like, "Well, yeah, I mean, yeah, she sucks, but that's kind of like the vibe that I got. Like, well, that's just who she is, and that's another issue." So anyways, back to this other preceptor. So she also, when I was giving a report to this day shift nurse, I was telling him, what's going on. And she was like, "That's not what that is." Like you could tell she was annoyed. Like she's like, "That's not what that is. This is," I forgot what I was explaining to him. I was like, "I think this person had like a," God, I can't remember. Oh, it was such a long time ago. But she corrected me in a way, and the guy was just looking like awkwardly because he just didn't know how to like take this exchange. He was looking at me. They both were looking at me, and I was like, "I don't know. I just want to fucking leave. Like, I just don't feel I want to be here anymore. Like, I hate this place. The culture sucks." And there's just a lot. And so it came to a point where basically, I mean, there's so many other interactions I'm leaving out because I don't want this to drag on. But I'm telling you, It was the worst. It was one of the worst experiences I've had as a nurse. And so I was having a really bad time here. I didn't feel supported. Like, you know, it was bad. So one day, the boss actually comes and she's like, "We need to talk." And I was like, "Okay, great. I know this." I was like, "Okay." And so all of a sudden, I walk into this room and my preceptor's there, and there's another lady that's there. She was like an educator. She's an educator, and she was like, "Yeah." The boss was like, "Yeah, we've been hearing that you've just having a really bad time. Your preceptor just told me about this, and this." And I should pause the story to say my preceptor never once came up to me and told me like she mentioned like like I have some concerns, but we never addressed the concerns. She just was like quietly watching from the corner of her wherever she was at. So she was noticing these things and taking notes and not telling me. So then when I walk into this meeting with my boss, who has already received those emails I was talking about from the first educator, and now she already has a bad opinion about me. So I feel like really blindsided in this meeting. Okay. So they're just like, if you don't improve, in the next couple of weeks, we're going to have to let you go. And like the nurse educator was like, yeah, she was like, yeah, I mean, there's a blood pressure that you didn't address. It was like 145/90, and it was like that all night. And I was just like, I don't remember this. So I was like, oh my God. Like, I was like, I don't think that blood pressure was that high. And it wasn't. I know like certain blood pressures, depending on the procedure, I know this, guys, you don't want blood pressures that high, but this person was not, like, it wasn't a procedure patient. I can't remember. I'm going to be right. Like, a lot of these memories are lost to time. I just remember her harping on the fact this person's blood pressure was 140/90 all night. I was like, there's a lot of people's blood pressure that are 140/90 all night. Anyways, it wasn't like a procedure or anything like that. This person was a post procedure, something where I felt like it would have been an alarm if their blood pressure was that high. So anyway, they're both like, all three of them are just like talking about like how they don't think this is going to work out, but we'll give you a couple more months, we'll give you a couple more weeks, and if you can't get it together, then you're gonna have to go. And I knew even after this meeting, I was like, I'm gonna leave. I'm gonna quit because I don't like it here. I don't feel appreciated here. I don't like my preceptor. I feel like there was a lot of a passive aggressive BS that was going on. And I just don't like this floor. Like, I think I still feel like it was a great floor, but I did not like the culture. And shortly after that, I remember the last night that I was there, I went to work and I was sitting there getting reports. Okay. Not getting reports. Sorry. I was looking at these patients. And then my bozo preceptor was like, she was like, or she's like, you're here awful early or something like that. Or it was like, what are you doing here? You're here awful early. I was like, you remember you told me I should start showing up early so I can start getting reports, so I can be more educated by my patients? And she just kind of like looked at me and disappeared. I was like, whatever. So then maybe like 15 minutes later, she comes back up to me and she's just like, the boss wants to talk to you. And I was like, what? She's not even here. It's nighttime. She's on the phone. So I know that she went and called the boss because she was just like, why is she here? It's so, like, she was really annoying. So then I talked to the boss, and she's like, hi, like, I thought that, we decided that your last day was, I don't know, X what amount of days. And I was like, oh, like, I didn't know. I mean, I'm here. I mean, I can stay. But then as soon as I said that, I was like, why the fuck am I going to be here? I don't even like this place. And I was like, you know what? Actually, you're right. I will leave. And I can't remember what she said after that. She's like, your insurance for your job, it'll stay for the end of the month, so you don't have to worry about that. I was like, great, that's fine. Thank you very much. I'm out. And so after that, I had like walked right past my preceptor. I think I left a bunch of stuff too. Like, I think because I had it's like a little tray, but it had like nursing stuff in it. Like, it had like syringes and alcohol pads, pens, stuff like that. I left it because the preceptor who actually gave it to me actually was the one who left. So I was just like, I just literally just not want anything else to do with this job. so much ever. I never literally, I like went home. I think I like threw the scrubs in the trash because I just literally never want to see this color scrub ever again. I say all that to say that 3 months later, I was hired at a teaching hospital, and it was one of the best experiences of my life. I've met my best friends there. I'm still friends with them today, and it was much more, I think, less cutthroat environment. I think the nurses who were seasoned were willing to help you, not make you feel bad if you made a mistake. And Jess was like really would be in the room with you. Like I just cannot, now that I'm a seasoned nurse, if I saw one of my students struggling, another nurse struggling, I just would never just sit in the room and just like, if they had an admission, I saw they were drowning. That's not of me. Like I don't understand nurses who are perfectly content with watching others drown. It's what, even as a new nurse, like I feel like I just would not, if I knew that the nurse was flustered, I just wouldn't put them in that position, because it's not, their esteem is shot. Like they're not gonna perform to the best of their ability. So I'm not gonna sit there and just literally watch them drown. Like I will never do that. If I go back to nursing, I will never ever do that. So I say all this to say that if you're a new nurse, find the environment is everything, I think, for you to thrive. Teamwork is everything for you to thrive. If you're in an environment where the people, if you're not vibing with the people, I would leave if you can, because I remember that really, that whole experience really was traumatic for me, and it really hurt my esteem for a very long time. And I'm just so glad and so thankful to have, been hired at the hospital that I was. And I did great, and I ended up working in the ICU, and really enjoying the everybody who was there. It was just just a vastly different unit. Interestingly enough, when I was in the ICU, I actually met that same nurse who was very mean to me. She actually came to the ICU that I was in, and then I don't think she remembered me, but I wasn't gonna like spark up. I was like, remember that time you were really embarrassing, you embarrassed me and you humiliated me? Like I wasn't gonna do that, but she was like talking about the environment, at our old job, and she was like, yeah, like the people there aren't that great, the doctors aren't that great, the environment's not that great. She only confirmed what I already like knew. It's unfortunately that, that I had to find out that the hard way, and she was, she didn't help at that time either. But people are different, I guess, depending on their environment as well. So don't give up. And again, environment is everything. If you don't, I would say when you interview for jobs for nursing, like it's just as much an interview for you as it is for them. So if you don't feel like you're vibing, you don't like the environment, you don't like what you see, like I would leave, because there's plenty of other places where the nurses are great and they're willing to help you, and you can learn a lot. So yes, I hope that encourages someone who is having a hard time, because not every sorry, that's a fairly large bird, sorry, not every nursing environment is great. Okay, so yeah, that's all I have. I hope that story helps somebody.